Hi guys, hope you're all well. This is the last. Today we'll be studying about the axillary nerve. Okay guys, let's get started. Guys, axillary nerve is one of the branches of the posterior cord of brachial plexus, a very beautiful nerve which is under the cover of deltoid muscle. It is also known as the circumflex nerve. Why circumflex? Because it is going around the surgical neck of humerus. It is circumflexing the surgical neck of humerus. That is why it's called circumflex nerve. That's one of the reasons that if the surgical neck gets fractured or there is dislocation of the shoulder joint, axillary nerve will be usually damaged in that cases. Okay, guys, where is the axillary nerve coming from? It is coming from the posterior cord of brachial plexus. Posterior cord has 5 branches now. Ultra mnemonic, we studied that now. The upper subscapular nerve and the last one is the axillary nerve. They will have the root value C5, C6. You can watch the video on brachial plexus which I made. It can help you in remembering the root values of the nerves easily. That's one of the very important concepts, guys. We'll study that again soon. And guys, there is came from the posterior cord. Now, where did it go? Posterior cord of brachial plexus is entering through the apex. It is around the second part of axillary artery. It is going down, where it is going into the quadrangular space. If it is going from apex into the quadrangular space, what are the structures around it? Mainly, it is said that there is subscapularis muscle behind and the axillary artery third part is front, because it is taking origin from the second part. Second part is where the posterior cord is. From posterior cord it is coming down. Now, if it is coming down, it will be in front of it will be the third part of axillary artery. Behind will be the subscapularis muscle. Between it is the axillary nerve. And it is going into the quadrangular space. Quadrangular space, we studied that now. It was a space, this mnemonic we studied that, isn't it? So it enters the quadrangular space and divides like this, anterior and posterior branch. It's coming from the axilla into the quadrangular space, divides into anterior and posterior branch. Anterior branch circles around the surgical neck of humerus. That was the relation of the quadrangular space, a boundary of quadrangular space. So that is going around the surgical neck of humerus. Then what is it supplying around the surgical neck of humerus? There is deltoid muscle over it. So it is supplying the deltoid muscle, the anterior and the middle fibers mainly. And not just the muscle, it is supplying the skin in the anterior inferior aspect of the deltoid muscle. That is also cutaneous innervation. Then there is posterior branch. Posterior branch came behind. Now, what muscles did it supply? That is also supplying deltoid muscle. Which fibers? Posterior fibers. What other muscle? Teres minor muscle. We studied that. Now, that was also a boundary of quadrangular space. Then it pierces the deep fascia and continues as upper. Deep fascia is what separates the compartment of muscle. It pierces the deep fascia and continues at the upper lateral cutaneous nerve form. We'll study that when we'll be studying that when we study the cutaneous distribution of the nerves. Okay, that's a beautiful concept. We'll study the importance soon. Basically, that when the particular nerve root is damaged, that area sensation may be lost. We can find out that by just simple test. We can touch it, and if they don't feel that sensation, we can go get an impression that what spinal level might be damaged. Interesting, isn't it, guys? That's one of the beautiful things which happens in anatomy. Guys, what is the clinical importance of it? Why are we studying this? See, this axillary nerve is supplying the skin over the anterolateral aspect. Now, we studied that in the last class that during intramuscular injection, if it is given in the upper part of the deltoid muscle, there can be injury to the axillary nerve. What happens if there is an injury? There will be paralysis of shoulder joint. One more thing can happen is this cutaneous distribution can be lost. This area, if the cutaneous distribution is lost, that is also known as the regiment badge sign. Why? Because in armies, when there are in a particular regiment, the badges will be in this region. So the sensation will be lost in this region. That's why it's called the regiment badge sign. Okay, guys. If you have any doubts, please post it in the comment section. I'd be happy to answer you. Keep learning, keep enjoying. Bye.